Hello, and welcome to our weekly ICT4D conference podcast. My name is Sonja Ritzel from CRS, and I'm interviewing experts for you to talk about digital development trends, innovations, and good practice. Today I'm pleased to welcome my CRS colleagues in the Gambia, Ousman Njie, the head of office, and Alieu Bah, the project officer for the malaria program. Thank you so much for joining me and talk about your youth engagement in the malaria programs in Gambia.
Thank you.
So as part of our ICT4D conference podcast, we are exploring initiatives and trends around digital diversity, equity, and inclusion. The topic of youth engagement is obviously very important. And here I don't just mean specific programs for the younger generation, but also including young people in our work. So I think your program with the malaria response in the Gambia is a very interesting one, how you're engaging the youth for data collection. I would like to ask you if you can share a little bit more about the program and explain how you are engaging the youth.
Thank you so much, Sonia. CRS in the Gambia is supporting the Ministry of Health to implement health programs. That includes the malaria program in the Gambia. And since the beginning of the grant, the Global Fund grant, CRS was given the responsibility to coordinate bed net distribution, long-lasting net, insecticidal net distribution in the country, and also behavior change intervention programs, also coordinating the civil society actors in malaria prevention and control. And one of the key areas that we have looked at is to improve our data management, from collection to analysis and dissemination of the information. And eventually we realized that digital technology is the way to go. And we therefore initiated that program through use of mobile devices to collect the information. We have engaged extensively youth in the country to be engaged in that program by training them, providing them with the tools to go out countrywide to collect that information. And it became very interesting to youths because they have seen something for the first time that has never happened in the country before. So really, we have seen that as a very useful way of managing our information, but at the same time also engaging the larger youth population, because this is a country where unemployment rate is quite high, and engaging youths in this type of campaigns, would take them off the streets and they're able to meaningfully contribute in this particular prevention program, malaria.
Thank you, Ousman. Alieu, as a project lead, do you have anything to add?
In addition to what he has said, we provide capacity building for youths. And he also talked about the employment opportunities we create, because if you look at our campaigns, sometimes they go to up to a period of 2 months, and the SMC is a period of 4 months. So engaging them for that period provides a lot of capacity building opportunities as well as employment opportunities. Our youths are fully engaged with CRS during these periods and activities.
And can you maybe explain a little bit more what is really their responsibility? So how are they being involved in the data collection? If you can maybe paint the picture a little bit.
Once we train them, we post them to the communities where they go and visit households and collect information directly from the beneficiaries. This could be biodata, personal information of households, that is during the campaign, where they will issue barcoded vouchers. In the SMC also, they collect the information of the childs who are eligible to receive the medication. So these are stored in our database, and once the children are treated, their barcodes are scanned, and we are able to monitor the amount of children we have been able to reach during the 4 months that we provide the SMC intervention.
Shall we talk a little bit about what are your lessons learned? What were sort of the key takeaways or any challenges you came across?
Regarding lessons learned, we have noticed that the time spent to implement the airline distribution campaign, previously using paper-based and now using digital technology, is quite shorter. You don't need that much storage space to store the large amount of papers that you would have used if you are using paper-based. In this particular one also, we have seen data being collected and analyzed in real time, because the moment data is punched in, we're able to see it as they collect information. So we're able to also make decisions as the campaign progresses, not waiting until the end of the campaign to make some critical decisions. The other interesting part is we're able to know areas that are adequately covered or not, because we look at the geolocation of the data collectors. Have they adequately covered that particular area? You are able to know by seeing the geolocation, as the campaign progresses. And the other interesting part is the fact that youth are seeing it as a very interesting tool, and therefore they actively engage and participate in the whole exercise. I think these are critical things that we want to see and would continue in our various campaigns that we conduct.
In addition to what Ousman have just stated, there has been challenges. He said near real-time data. That means we are faced with internet challenges. But the device and the app that we use has been developed in such a way that you can work with it offline. And then when you reach areas where you have good internet connectivity, you can upload data. That is why not 100% of our data is real time. That is one of the challenges. The other challenges we are faced with, especially in the rainy season, it's difficult to access some of the areas because the roads are usually very terrible. So that makes it difficult to reach those areas. And another constraint we are faced with is in the provinces, there are a lot of areas that don't have electricity. So in order to mitigate the lack of electricity to charge our devices, we have provided solar chargers as well as power banks, which the data collectors can use when they are in those remote areas where there is no electricity.
Thank you. I also want to talk to you a little bit about safeguarding. So obviously you have very excited young people joining this project, and you sent them off to collect the data with the solar-powered backpacks and mobile devices. I guess having young people in the program, we always have an extra care around safeguarding, and we might also put them at extra risk, giving them these digital devices, considered valuable devices. So I want to talk to you a little bit about how you approached the safeguarding aspect in this program.
Thank you so much. This is also a very important area that we looked at seriously. And the fact that we are living in a country with a very small population makes it easier, but notwithstanding, we still ensure that the youth that are engaged are supported during field work, because we have a network of supervisors that are mostly health workers from Ministry of Health and our partner organizations, including CRS, to work with them. So they are provided with the necessary mobility to be able to move in the various communities. And wherever they visit, the community leader, normally called the alcalo, will be involved to make sure that youth are given a place to stay and also provided with the necessary support in terms of community members that will also participate, facilitating their work in terms of team movements, in terms of other logistic support that is provided. But added to that also, we train youth to understand their role very responsibly, because whatever you do also, you are doing it on behalf of CRS and partners like Ministry of Health. So they need to understand that they are, during that process, they are representing CRS and partners, and therefore they must comport themselves very well and understand that they are providing support to the beneficiaries, that is the communities, but must uphold the standards that is expected from them. And that is why training is provided. And equally, the communities are sensitized to understand the role that the youth are playing in this particular exercise. We need to understand that there is reputational risk, so we are very, very mindful. Added to that, after the training, they are also given an undertaking for them to understand that, yes, these are the standard processes and the way to act when I'm working with communities in the field. Thank you.
Thank you. How could such an engagement be replicated in other programs? Are there plans for engaging the youth in a similar way in other programs in the Gambia?
Yeah, since we started the use of ICT in our programs in 2014, it has continued to be used from the early line distribution to SMC. And now our partner, the Ministry of Health, through the NMCP, has started using it in the indoor residual spraying program. We have also used it in our migration project as well as our emergency project. And now the Ministry of itself, through the expanded program on immunization, is using it to record children who have been immunized and also use it to find out defaulters and go and trace the defaulters so that the immunization coverage will be strengthened. So it has been going forward. I'm sure other programs are interested in how we are able to come this far. So I won't be surprised if every sector in this country going forward adopts the use of ICT in programming.
Thank you. That's a very optimistic outlook, and I'm hoping that also other regions are listening. And if they are not engaging the youth yet, they might be encouraged. Which brings me to my last question already. You mentioned that one of the reasons why you engaged particularly young people in this program is because there is a very high rate on youth unemployment in the Gambia. I wanted to just ask you more generally, what do you think the future holds for youth engagement in Gambia or for ICT4D or digital development or the tech sector?
I think this is an area that needs to be further expanded. And we are happy that, like Alieu mentioned, already other organizations and institutions, including government, have taken this initiative to include technology in their programming, which is very important. And we know when it comes to technology, the youth are leading. And we are happy that during our conversation with youth, they've mentioned that CRS is really forward-looking by including technology in their programming, which is interesting, but also providing opportunities for youth to excel and do more in national development. So I want to believe that this technology would further enhance our work, but also meaningfully engage youth in their activities in areas where they can provide the necessary support. CRS started this initiative in 2014, and we believe that now we're looking at other areas how we can better integrate data.
I think Ousman have said it all, but to just add a little, what we need to do as CRS to be more engaged in technology, because technology is constantly changing. So we need to keep track of these changes and ensure that all our systems are updated in line with the modern applications, and ensure that we also transfer these applications to the youths we are engaging for better service delivery.
Thank you, Alieu and Ousman, for sharing your insights, not only for engaging the youth, but also for building capacities within your health programming in the Gambia. So thank you for joining me.
Thank you.
More information about our upcoming podcasts or webinars are on our website, ict4dconference.org. I hope you will join us again next week.